Send a quick email to Zach and see what. All right, good morning. Sorry for delaying getting started. This Legislative Committee on Administrative Rules on Thursday, June 27th, 2024. We're checking on another member to join us. We do have a quorum at this time. We have at least one member in our Ledge Council on Zoom, and we have anniversaries and other things going on with multiple committee members. So we're a little thin, but we're here. So we'll get started by doing introductions, and to my left.
Carol Odie, State Representative, representing the far north end of Burlington.
Senator Dave Weeks, representing Rutland County.
Representative Trevor Squirrel, representing Hunter Hill and Jericho, and on Zoom we have
Senator Chris Bray, representing Addison Senate District.
And Ledge Council.
Damian Leonard, Office of Legislative Counsel.
And, all right. Okay. First order of business will be the minutes from June 13th, 2024. Got a motion?
So moved.
Senator Weeks moves to approve the minutes of June 13th. Any discussion? All those in favor, please say aye.
Aye.
Aye. Actually, we have 4 right now, right?
Yeah.
All right, we can proceed, but we can't vote. So we have a 5th member. What?
He's having problems getting in, so just resend it.
All right, we'll still move along with rules, okay? And we'll come back to the vote on the minutes. And most of this town will want to figure it out. Okay, first up is going to be 24P13, Department of Health Unused Drug Repository Rule. Speaking for the department is Natalie. Is it Wheel? I have it right.
It's while, like in a while.
I probably had a 50-50 chance on that one. Why don't you proceed?
Thank you very much. Good morning, Chair Squirrel and committee members. My name is Natalie Weil, and I'm a policy advisor for the Department of Health. Everyone can hear me okay?
Yes.
Wonderful. So with this filing, the department is proposing to adopt the unused drug repository rule. The purpose of this rule is to establish the requirements for the operation of an unused drug repository program. This will be a new program for Vermont and will be administered by a third-party contractor. What is an unused drug repository? An unused drug repository program is to get medication into the hands of people who need them. The Unused Drug Repository Program collects and distributes unused medications to those who have difficulty affording them. Medications that would otherwise be discarded are collected from institutions like long-term care facilities and individuals. The medications are then inspected by pharmacists for safety, like making sure they're properly sealed, not tampered with, and not expired. Patients access the medication through participating pharmacies and clinicians. This rule establishes the requirements for participants in the program, from donors to prescribers to recipients, to ensure the program is safe, effective, and equitable. The regulations address the different types of participants within the program administrator, collection sites, dispensing sites, and recipients, who are the patients. The rule also ensures that the drugs are handled appropriately and records are appropriately maintained. The rule also includes the limitations on liability, which are directly from statute 18 VSA 4672. In drafting this rule, the department worked with DEVA, OPR, the Board of Nursing, the Board of Medical Practice, the Vermont Medical Society, VAS, and current unused drug repository operators in other states. All interested parties are supportive of the proposed rule. The department worked particularly closely with OPR and the Board of Pharmacy and are very grateful for their assistance. With that, I'm happy to answer any questions you have.
I will mention that we did receive letters from the jurisdiction of chairs of health, human services, and Senator Lyons, Health and Welfare Senate, that approving that rulemaking needs
I did have a question.
Senator Weeks.
Yeah, thank you, Natalie. So it appears that there's two programs for unused drugs potentially in the state. One to discard and destroy, and the other potentially to collect and reuse and redistribute. How does a citizen know which program to participate in?
Thank you for your question, Senator Weeks. You're correct. There is a program in Vermont that takes drugs and disposes of them. We refer to them as take-back sites. Luckily, this program, this unused drug repository program, does allow for the integration of the proper destruction of these medications if the medications are not viable for the program. So medications that this program may receive that are expired, not properly sealed, this program can divert that medication away from the waste streams appropriately and put those medications into those take-back sites.
Okay, and then what happens with the mail-in, the discarded drugs? Are they potentially diverted towards the reuse program, or is that just if they end up in an envelope for destruction, that's where they go and they're never evaluated for reuse? Is that correct?
I'm not sure I understand your question. Do you mind rephrasing?
Yeah, so just from my experience, I get a mailer, I request a mailer for drug destruction, but it goes to a third party in some other state. All those drugs simply get destroyed. They don't get evaluated for reuse or not.
That's correct. That is also my understanding. If you are specifically if you are specifically trying to dispose of your drugs, they will not enter this unused drug repository program. This is a regulated program where you need to work through the steps to make sure that you're included in this program. I don't believe that medications that you're trying to destroy will somehow come into this unused drug repository program. This has very clear borders about when medications will be included in this program.
Thank you, Natalie. Thanks.
Committee members, other questions? We're getting some feedback here. Not sure where it's coming from. If you've got your mic on, I don't know if there's any background noise for any participants. Okay. Seeing no questions, Senator Bray.
Mr. Chair, yeah, please. I would move approval of Rule 24 P13, Department of Health Unused Drug Repository Rule.
I would add with proposed modifications submitted by the Department of Health in the memorandum dated June 19th, 2024.
Thank you.
Any additional questions? All those in favor, please say aye. Aye. Representative Bongard? Okay, we'll have to come back to this. Okay? I'm going to move on. As far as the vote goes.
Okay,
next
I'm in. I've been having trouble. Yes, aye.
Okay.
Sorry.
Thank you. Rule
Now
that.
I'm finally in. Okay.
Rules adopted. Okay.
Okay.
Thank you. Okay, next rule is 24P14. Natalie, you're up again. This is the Department of Health Reportable and Communicable Diseases Rule.
Thank you very much, Chair. For the record, Natalie Weil, Policy Advisor for the Department of Health. With this filing, the department is proposing to amend the Reportable Communicable Diseases Rule. The purpose of this rule is to protect public health through the control of communicable and dangerous diseases. These regulations require the early and prompt reporting of listed diseases so that the Department of Health may take any necessary protective action. This rulemaking does the following. It modifies the content contained in reports to include additional information if requested, removes the requirement to report negative and indeterminate SARS-CoV-2 lab results, the lab test for COVID-19, to the Department of Health. This rulemaking changes the required reporting period for positive SARS-CoV-2 results and COVID-19 from immediately to within 24 hours. The rulemaking adds mpox to the list of reportable diseases and the associated laboratory finding called non-variola orthopox virus to the list of reportable laboratory findings. The rulemaking clarifies that immediate reporting for identified diseases and laboratory findings means that they must be reported immediately by telephone to the department. The rulemaking requires additional organisms to be sent to the department laboratory. The rulemaking updates and clarifies various other human and animal diseases, syndromes, and laboratory findings required to be reported to the department, and the rule reorganizes the rule for clarity. In drafting this rule, the department worked with 40 infectious disease clinicians, 26 clinical lab directors, and microbiology directors representing every Vermont hospital, the Vermont Veterinary Medical Association, Vermont Agency of Agriculture, Food and Markets, Vermont Department of Fish and Wildlife, USDA Wildlife Services, USDA Veterinary Services, who have all reviewed and support the proposed changes. And I am happy to answer any questions you may have.
Thank you, Natalie. And again, we did receive letters of support of the rule from both House and Senate in this jurisdiction. Any questions from committee members? Senator Bray.
Thank you, Mr. Chair. Ms. Weil, a quick question. So these sound familiar to me. Have these been amended through emergency rules and now they're becoming permanent? Is this the road we're on here?
Thank you for your question. That is correct.
Okay, thank you. Mr. Chair, if there are not other questions, I would move approval of 24P14, Department of Health Reportable and Communicable Diseases Rule. I don't know if there's an amendment to that through memo as well.
There were proposed modifications submitted in a memo dated June 21, 2024.
Thank you, Mr. Leonard.
Any other questions? All those in favor, please say aye.
Aye.
Aye. Representative Baumgart?
Aye.
I didn't hear it. Okay, thank you very much.
Yep.
Thank you, Natalie.
Thank you very much for your time.
Okay, next rule up, Rule 24P12, Agency of Natural Resources Above Ground Storage Tank Rules. Speaking for the agency, Anna Barakovsky.
Yeah, you got it right.
And I know this fellow, Matt Chapman.
Good morning.
You're not general counsel, you're something else.
I'm not. I'm the director of the Waste Management Prevention Division. So Anna and I work together.
All right, thank you. Good morning. Thank you for allowing me to be here. So I am presenting the above ground storage tank rules, and these are revisions to the 2017 rules that are currently in effect that established inspection standards for above ground storage tanks. So the current provisions we are proposing include additional design and installation requirements for new AST systems. We work closely with Vermont Fuel Dealers Association to develop these revisions. So these are new technical specs that new tanks would be required to have. We have also proposed a new yellow tag provision to the inspection standards, which is the most significant provision. And this was done in order to have a more balanced approach to tank compliance inspections, where tanks that are found not in compliance but are not an immediate threat to the environment or a petroleum release are yellow tagged rather than red tags. So there isn't an immediate prohibition of a fuel delivery. That has been happening in winter, and tank owners were being cut off from a fuel source in the middle of winter, which has been a problem. So we're taking a more balanced approach to have a provision that allows for a yellow tag, and then tank owners are allowed until May 1st of the year, so after the heating season, to make the necessary corrections to their system to make it compliant. And we established the standards for how to issue yellow tags and for which non-compliance items that is permissible.
If I may, so there's a set of guidance here, because it seems to me they could be subjective.
So there is some subjectivity associated with them, but we require the dealer who's doing the inspection to photo document and provide us that information. So, we're making them be honest with what they're doing and documenting the basis for what they're doing, so we can follow up on compliance related issues.
The subjectivity is really in terms of the rest of the tank. Some of the other components are like pipe diameter not being compliant, so that is very easy to verify. It's either in compliance or not. With the rust portion, that there is some subjectivity, and it's the professional discretion of the fuel dealer that is inspecting the tank to make that determination. We are also changing the inspection interval from 3 years to 4 years to give the industry more time to be able to stay compliant with the requirement, which is something that the industry has struggled with since 2017. We have proposed several phase-in requirements for existing tanks to address existing reasons for why tanks fail. They weren't included in the 2017 red tag list, so we're phasing them in by 2030 for existing tanks in order to help reduce petroleum releases. So we're giving 6 years for the existing tanks to come into compliance with those standards. And we also just provided some clarification for inspection standards in which tanks require inspections and which tanks do not, and reorganized the requirements for readability. And so it's easier to understand what the requirements are for the industry, and provided some technical definitions that were lacking from the current rules. So in a nutshell, these are the major changes that we are proposing.
Thank you. Senator Bray, I'll turn to you quickly. You good with this?
Yeah, if I often sign the committee form when I'm there if I have a few questions, and I did want to ask a couple of questions, please, about the yellow tagging program and the experience lately. My recollection from earlier discussions on this were that there was a lack of a workforce shortage issue, in part, that was rate limiting for how quickly tanks could be brought up to code. And then I'm guessing too, in some cases too, for the homeowner or renter, it might have been a financial issues as well. But can you just, so I get the idea of, a yellow tag program is kind of an intermediate step. Sounds like an attractive thing. Well, I guess if you could just say a little more about why the yellow tag program, and do you have any concerns that the longer interval or sort of the intermediate adding time through a yellow tag program might lead to more failures? Can you just talk about how you're assessing and balancing out that risk?
Yes, certainly. So yes, you're correct. In addition to having the fuel prohibition being a hardship for the tank owner that is cut off from their fuel, there's also been a shortage of technicians. So replacing a non-compliant tank is not something that can always happen immediately. And obviously the financial burdens of replacing a tank are also really important. So we felt that the May 1 allowance provides a balanced approach that by May 1st, technicians tend to have more time because it's after the fuel delivery season, so they're not on the road as much and they can address the non-compliant tank replacement. And it also gives some leeway for tank owners to either come up with their own funds to replace the tank or to apply for the PCF funding that the state can provide to help with the tank replacement for those that qualify. So we did consider those two aspects when developing this provision, absolutely. And I'm sorry, what was the?
Well, and I think the other thing just to be aware of is that when something gets yellow tagged, there are both restrictions on the rate of fill and the amount of fuel that can be in that tank. Again, trying to minimize the risk that's associated with the potential for release, knowing that we have some non-compliant aspects associated with that tank. So I mean, I think we're always concerned about a non-compliant tank and the potential for a release. We're trying to balance that against people obviously needing heat during winter, and how can we do this in a way that recognizes that we have, you know, human resource shortages in the technician field, but also, I mean, we've had and financial issues with homeowners. So I think that we went out of our way to try to strike the balance there, and I think we got it and worked hard to try and get there.
One of the ways we've been trying to address this since 2017 is fuel dealers have been asking for a temporary exemption or a permission to fill a red tag tank. So they would contact us with information about the tank, sometimes with photos, ask for additional time to replace the tank and permission to fill the tank. So that's how we've been handling in the interim. We have not had any releases since we started doing that. So this is kind of a way to create a formal process for doing what we're already doing in order to help people not be cut off from their fuel in January.
Yeah, when you say there's been no releases, so you must have a report back mechanism if you're giving permission for them to fill that tank or at least partially, it's red tag, right?
We do. And the tank stays red tag. So the tank is already notified to us. So we know where that tank is and that it is a non-compliant tank. And the fuel dealer is also notified that they only have a certain amount of time to fill that. So, and after that time, there was the prohibition does kick in. So we sort of already have been informally doing this and it's been working. So this is a way to write this into rules in order to have more standards and more guidance for how to address this issue.
Is there a required feedback from the dealers, or is it only if something happens, they let you know?
The required feedback is either if something happens, they have to let us know, or if the tank is replaced, they have to let us know so we can take the tank off the list.
There's no automatic, let us know what's going on. Yes, no, it hasn't been.
The way I've been managing this is on May 1st of each year, because we've been using May 1st as the deadline. I contact everyone who has asked for this conditional permission to get a status update. And if the tank is.
Right, so you're doing that.
So I'm doing that, yeah.
Okay.
In all of these cases, the tanks have gotten replaced even before May 1st. It's just that sometimes the fuel dealer needed like a month to replace the
I
tank.
understand. Committee members, Senator Bray?
Yeah, one more question, please. Thank you. Can you just say a little bit about the choice to move from a 3-year to a 4-year cycle?
Sure. So the 3-year cycle was kind of arbitrarily chosen. It wasn't in 2017 when the standards were set. It wasn't an analysis wasn't done of how frequently tanks failed. So it was really just something that the program managers that were working on these rules with the VFDA came up with. And it became quickly apparent that 3 years is not a workable timeline for fuel technicians to stay compliant with the rules. So a much more, a longer time frame was actually requested by the VFDA, and we went back and forth and kind of settled that we're going to expand it by 1 year. We feel that for newer tanks, it can actually be longer, but it's very confusing to have different time frames for new tanks or old tanks and keeping track of the age. So this was somewhat of a compromise to give some relief to industry so they can stay compliant. We also don't have any data that really show us that tanks fail at 3 year. The 3-year interval is the right place, so it was arbitrarily chosen. So I don't know if you would like to add anything to my answer.
No, I think that more or less sums it up. I mean, I would say, I think having been around in the older ones, the underground storage tank program has a 3-year inspection cycle. And I think they just decided to copy that for above ground storage tanks. And, you know, it became apparent that the fuel dealers were struggling just with, you know, we were asking them to perform the inspection function. State employees aren't doing it. So it's that balance, right, between, they wanted a much longer time. We were comfortable with 3, like Anna said, I think we were comfortable with 3 and knew that with newer things, it could be longer, and we settled on 4. It was a compromise sort of position.
We're hoping that the yellow tag provision also allows for tanks that are sort of borderline passable, that they will be yellow tagged instead and replaced by May 1st. Because I think a lot of fuel dealers struggle now where the tank is passable, but it's barely passable.
I have a question. When we think about above ground storage tanks, we think outside the building.
Mhm.
A lot of people have fuel storage tanks in their basement.
Correct.
Is it the same requirements?
Yes.
Correct.
So someone has to come in and check it out and
Yes.
same schedule.
Yes, and have an appointment.
There are no differences.
Correct.
Okay.
Correct. And that's frankly one of the challenges, right? Is
Yeah.
scheduling with a homeowner to come in and do the tank inspection.
Chances are if it's inside, it's probably safer than if it's outside. Maybe that's not the case.
Well, it's a mixed bag, right? You know, it potentially is safer, but if a release happens, it's a lot more of a problem.
Yeah. Committee members? Senator Bray.
So thank you, Mr. Chair. I have signed off on the official committee form, which I would have brought in. I'll send it to Charlene. And with that, I would move approval of Rule 24P12, Agency of Natural Resources Above Ground Storage Tank Rules. With
proposed modifications.
Yes, with
submitted
proposed modifications. Thank you.
of June 12th, 2024. Any additional conversation? Questions? All those in favor, please say aye.
Aye.
Okay, thank you.
Thank you.
Matt. Thank you, Matt. Okay, next up is 24 P15 Occupational Safety and Health Administration, improved tracking of workplace injuries and illnesses. Let's see, we have Dan Whipple. I think I saw you on there. There you are. It's all yours. Go ahead, Dan. Can't hear you. Working on it. Still can't hear you. All right, Dan's working on his technical problem.
What, move to the next?
What?
What,
Do you-
move to the next?
Mr. Chair, do you want to move back to approving the minutes from the last meeting?
We can do that. Let's do that. Since we have Representative Baumgart's back on. There was a motion to approve the minutes of June, June 13th. And so that's the motion. Any discussion? All those in favor, please say aye. Aye. Okay, thanks. You all set, Dan? Apparently not. Okay, while Dan does that, what?
Who made the motion? Okay. Thank you.
There's a lot of those, right? All right, we're gonna move ahead to, agenda item, which is request for extension of adoption deadline. While Dan's working on that. This is regarding Rule 23P43, Agency of Natural Resources, Vermont, mission vehicle and zero emissions. Well, actually, is Rachel Stevens on? All right, I guess we'll delay that.
And Stuart will be here.
Actually, see if you can.
He's gonna be here first.
What?
Stuart Sure is gonna be here in person.
Oh, Rachel is?
No, Stuart Sure for 22/44.
Oh, but that's not even on the agenda.
Yeah.
Where?
On 9, yeah.
The new version? Okay. I see. Must have updated since I first one. Thanks. Right. So
I will let you.
we're waiting on folks right now.
I'll email you. So
Dan, you there? Can't see you. All right, we're gonna take a 10-minute break. How's that? Come back in 10 minutes and then we'll see where we are with everybody.